Hello everyone. Welcome to this presentation on seasonal affective disorder, or SAD. My name is Suzanne Pichet. I'm a mental health nurse by specialty, but I have over 25 years of experience in a variety of positions within the nursing field in the Canadian Forces military and in the civilian world. I live in Denmark now, but I'm Canadian and I work contracts for military services as well as other institutions where Canadians are. Questions that we're going to answer tonight, pretty basic stuff. What is it? Who's affected? What causes it? How do you know if you have it? Can it be treated? And can you prevent it? So let's start off with a good definition. First of all, I feel like I'm going to try to explain something that isn't relevant enough to be something, but yet it is something. So many people may or may not be affected by this. And it was a disorder at one time, but now it's not. So historically, it was recognized as a disorder in 1984 after research was done by Norman Rosnell and Herb Curran. And the disorder was actually labeled as a disorder at that time. In 2013, however, the DSM-5, the Diagnostics and Statistical Manual of Mental Health, released a new publication saying that SAD is not a disorder on its own anymore. So it's now a descriptive, depressive descriptor. So if you have a diagnosis of mental health depression or bipolar disorder, then this could be something that you're going through that describes the disorder. Anyway, all that being said is that it was a disorder that was recognized. Now it's been changed. So officially, I can't say that this is a disorder. However, there's many mental health professionals that don't agree with this since the 2013 publication came out, and the fight is on. Whether it's a disorder or a descriptor, basically, I'm going to talk about something that does affect many people, and that's the point of what we're here to discuss today. So just some base level questions. I won't go through all of these questions because, of course, it's for the live version when we went through it. We'll just go straight to answers, and I'll read them through. People with seasonal affective disorder are only affected during the winter season. That's false. People with SAD have depression during a certain season of the year. Most people with SAD are depressed during the fall and winter months. Rarely other people with SAD are depressed during the spring and summer. So it's a little more complicated, and this form is called reverse SAD or summer SAD, and we'll talk more about that later. Women and teens are more likely to develop SAD than others. That's true. It can affect anyone, but women, teens, and young adults seem more likely to get it. Also, people with SAD also tend to have a family member with mental illness, such as depression or alcohol abuse. Number 3, SAD can be hard to diagnose because its symptoms are similar to other illnesses. That's true. So it can be confused with symptoms of other illnesses, including hypothyroidism and viral infections such as mononucleosis. So if you're noticing signs and symptoms, a trip to the doctor could eliminate other more serious conditions. The hormone estrogen may play a role in SAD. That's false. Estrogen is not a player in this disorder. We can discuss that a little bit more later, but it's the changing neurotransmitters of serotonin and melatonin and its effects on your circadian rhythm that really have the effect on SAD. You may have perimenopausal symptoms, and you may be going through that period of your life, and it doesn't help, but it's not the cause of SAD itself. SAD is more common in northern regions. That's true. The overcast days also make you feel very much more worse if you have SAD. One symptom of summer SAD is weight loss. That's true. Other symptoms of SAD include sleeping problems and poor appetite. For those with winter SAD, it's, of course, the opposite, feeling blue during the fall and winter, a craving for sugary, starchy foods, weight gain, and oversleeping. Number 7, a good way to feel better when you have winter SAD is to get outdoors every day. That's true. Regularly getting more sunlight is beneficial, and we'll talk more about the importance of sunlight later, but this can help prevent SAD. You can also move your furniture around, try to get near the windows and get as much sunlight as possible. For more severe cases of SAD, treatment may be light therapy. That's true. Light therapy means using a full spectrum fluorescent light for a certain amount of time, usually in the morning. And your healthcare provider can provide medications to help as well. But for winter SAD, often light therapy helps, and it's started in the fall before the symptoms begin. Number 9, tanning beds are a good replacement for light therapy. This is a misconception. It's false. Tanning beds have UV, ultraviolet light, which affects the skin. Now, this can have a positive increase in the vitamin D production, and we sometimes recommend their use for treatment of certain skin disorders, such as psoriasis, but it can adversely affect normal skin, and it can also affect eyes. So it's not recommended. Light therapy, on the other hand, uses light boxes with a full spectrum fluorescent light, which affects both skin and eyes with the goal of increasing serotonin levels, not damaging them. Winter SAD and summer SAD are treated exactly the same, and that's false. Although the heart of the disorder is based on the same issues, changes in seasonal light or lifestyle that increase vitamin D or disrupt the circadian rhythm, symptoms are opposing. Therefore, there's definitely some overlap with the treatment. You know, we're going to do a lot of the same things, but they're not treated exactly the same. So, what effects do seasons have on us? Like the cartoon says, in a nutshell, summer's too hot to go outside, winter too cold to go outside. We're becoming a society that stays inside. As well, we have our technology, TV, computers, games, phones, iPads, etc., our comfort stuff. So if it's a nasty day, or if we just don't have a reason, we don't go out. This isolation can lead to or aggravate existing depression, and it can promote negative physical changes that can in turn lead to SAD. So again, I'll remind you that this goes hand in hand, according to the National Institute of Mental Health, with depressive disorders and bipolar. So it's just that this shows up on a regular seasonal basis. So who is affected by this disorder? Women are most prone to seasonal variations in depression than men. People who live far from the equator at higher latitudes, where winter daylight hours are very short. For example, if you take Florida in the USA, there's about 2% affected by SAD, whereas you go up to Alberta, Canada, there's 10% affected. People between the ages of 15 and 55, first-time risk is higher during this age range, but as you get older, it decreases. People who have a close relative with SAD, not because it's contagious, but depression, there's a familiar link, and that's the suspect here. Whether it's genetic or environmental is unknown. Again, studies are out on this one. So what causes it? So we're going to look at both winter and SAD, but I'm going to focus on winter because shorter days in the winter really bring on the majority of symptoms for the majority of people who do actually have this. So shorter days, especially in winter, lead to decreased sunlight. Decreased sunlight leads to a vitamin D deficiency. This in turn leads to an effect on brain function, causing a disruption of your circadian rhythm. When our circadian rhythms are out of whack, it can affect our levels of melatonin and serotonin, upsetting the balance of both of these and causing some dysfunction and symptoms. So SAD in summer, there's still an upset in the melatonin and serotonin, but it's not the decrease in sunlight that's the general cause, it's the opposite. And then the sunlight tends to increase stress and agitation by upsetting the circadian rhythm. And because it's affecting the melatonin and serotonin, that's still what causes the symptoms. And yes, there are some people who will have decreased sunlight because they'll stay in because it's too hot to go outside. So they'll tend to isolate themselves and stay inside. And then they're being affected very similar to winter SAD. So as I said, we're going to focus more on the winter SAD. So let's take a look at light therapy and how it targets our optic nerve. The sunlight comes in, enters the eyes, and projects onto the retina. This causes these little light-sensitive receptors to communicate directly with the SCN. So the SCN is short for a suprachiasmatic nucleus, and this is located in the hypothalamus of the brain. It's a little tiny spot. This is the major regulator of your circadian rhythm. Tiny, but very, very powerful. And it's the light exposure or the lack of light exposure hitting those receptors at the back of your eye that lets your brain know whether it's day or night. So the SCN, the SCN, the suprachiasmatic nucleus, is then prompted to provide this information to the pineal gland. So we're depending on the amount of light and the message of the SCN. The pineal gland will initiate the production and release of either melatonin or serotonin. And these two neurotransmitters are inevitably linked. So melatonin is produced when light becomes dimmer, nighttime, triggered by darkness. Remember the SCN in the hypothalamus from the last slide, it's not getting enough sunlight. So as the light gets dimmer, the pineal gland starts to synthesize melatonin, and it makes the melatonin from serotonin. So shortly after, the melatonin is secreted then into the bloodstream, and you start to feel sleepy. The varying concentration of melatonin in your blood throughout the day carries out many important biological functions to the circadian rhythm. It also acts as the body's most powerful broad-spectrum antioxidant. This antioxidant function ensures that as melatonin is released at night, it mops up all the junky chemical remains of biological functions that occur during the daytime. This is so important. In fact, the lack of melatonin due to a circadian rhythm disturbance leads to an increased risk of all cancers, heart disease, obesity, etc. Moreover, timing of sufficient melatonin concentrations has a large impact on sleep quality. This means that even if you do manage to fall asleep, but you have a low melatonin concentration in your blood, you will experience less of the critical stage 3 and REM sleep stages that are the most physically and mentally restorative processes. But the flip side of this is the serotonin production. So amongst other neurotransmitters, this is the primary neurotransmitter that produces feelings of well-being, happiness, being awake, alert. Serotonin production is directly related to how much bright sunlight you're exposed to. The brighter the sunshine, the longer an individual's exposure to it, the more serotonin the brain will produce. Serotonin is also produced in the gut. So if you don't have enough sunlight, if you're eating a good diet that has a lot of an amino acid called tryptophan, then you're going to be getting more of your serotonin production. Tryptophan is found in egg whites, meats, most nuts and seeds, and a small amount of fruits like bananas. But you can see how the primary egg whites and meats could be a problem for someone on a vegetarian diet. So sufficient amounts of the amino acid tryptophan in the diet is critical to ensuring that the body has those backup building blocks to create serotonin, which in turn, as you recall, turns into melatonin once we get the dimmer light. And then that allows you to have a good sleep. So these are on a cyclic basis. So just to give you an idea of how your circadian rhythm works. This slide is just for a bit of information and to highlight what goes on throughout the day. So melatonin secretions stop at about 7:30 in the morning, and that's of course when your serotonin starts to kick in once you get the daylight. And it kicks back in at 9 o'clock at night. And there's a lot of other things in there that you're doing based on when your serotonin starts and your melatonin starts. So as you go through the rhythm, you can see there's quite a few things that happen throughout the day that affect you within your circadian rhythm. So when this balance or rhythm gets disrupted, especially during darker winter months, it may explain the prevalence of depression during this time. So SAD, how do you know if you have it? So if you look at the symptoms in this chart, maybe you have some of these that you might be concerned about. So they're complete opposites. Overeating in winter versus loss of appetite in summer, weight gain in the winter versus weight loss in the summer, sleeping or feeling tired throughout the day with winter versus insomnia in the summer, depression in the winter, irritability in the summer, decreased sex drive in the winter versus increased sex drive in the summer, social withdrawal and destructive thoughts in the winter, but restlessness and episodes of violent behavior in the summer. Now, you may see the difficulty in the diagnosis with summer SAD just by thinking about these signs and symptoms. There's a lot of well-established social behaviors that happen in the summer, especially in North America. Summer vacations are common. It's common for school kids, young adults, and adults to be out for the summer on holidays, partying, like at a friend's or a beach party, or staying up to the wee hours of morning, drinking alcohol, acting rowdy, and these are common accepted behaviors in younger people. And it demonstrates the restlessness and the violent behavior. And this could be just a social thing. It doesn't necessarily mean that they all have SAD, but it's hard to distinguish between our regular social behaviors and SAD symptoms in the summer. So it can be overlooked, misdiagnosed. It's just harder to see it in the summer, whereas in the winter, it's fairly evident. So they're both affected by seasons. Both will benefit from most of the treatment recommendations. The treatment's just a tiny bit a tiny bit different for winter SAD because it puts the focus on stimulation, whereas in the summer, it puts the focus on depressing overstimulation and increasing relaxation. So to diagnose this, the fellow is the patient sitting surrounded by lights, and the doctor says, "Let me take a wild guess. You're concerned about seasonal affective disorder." Well, unfortunately, when we visit our healthcare provider, it may not be this obvious to them or to us. The most important thing is having a self-report. So I preach this a lot, but I think everyone should start keeping a health diary or health journal. It doesn't have to be a book. Even if it's just notations on a pocket calendar, if you're having any kind of signs and symptoms, then just jot them down somewhere so that you have something that's going to remind you as well. Healthcare providers are like detectives trying to piece together a puzzle of clues and come up with the best solution for you. So in this case, a 2-year history of symptomology is required. So that includes depression, mania, and hypomania with the seasonal changes. So now it's even harder to diagnose. So as soon as you start to notice signs or symptoms, start to write them down, what and when they happened. The more pieces that you can provide to your healthcare provider, the better the chances that you have an accurate diagnosis. And this is not just for this particular disorder. This is for anything that's going on with you. But as well, you want to approach your healthcare provider just to eliminate other issues. Like we talked about earlier, you want to eliminate hyperthyroidism and viral illnesses such as mononucleosis. So at the very least, expect to have some blood work and some urine tests done to investigate these issues. If you've already been diagnosed with a major depressive disorder or bipolar disorder, and it's actually quite common. So if you already have this diagnosis or you're going through perimenopause, then you may want to analyze this further with your clinical provider. Keep track of your signs and symptoms with your self-report, but explore this issue more with your clinical provider. Ultimately, you don't have to get a diagnosis before you begin your own prevention program. You can begin a self-treatment regime that's not harmful, but in fact, you don't actually have to have SAD. The things that we're going to talk about can help with all aspects of SAD, but also help with life functions in general. So these are the things that we're going to talk about that you can do on your own. Lifestyle, diet, and exercise, very important. That's the most important thing. Ensure you're active. Even a 30-minute walk daily is great. If you can go outside, even better for this particular disorder. Decrease your stress levels. Try yoga, meditation, pursue a hobby. Eat a diet rich in vegetables and vitamin D-rich foods such as fish oil, liver, egg yolks. Try to get your tryptophan in there with the egg whites and meats and nuts and seeds. If you're a vegetarian, you may need some advice or you may need to take some supplements. Sleep-wake hygiene, we're going to talk more about that later, so I won't talk too much about it now, but it's basically discussing your circadian rhythm. Vitamin D, again, the only way that you can get it is by sun exposure, diet, or supplements. And I'll talk about that in the next slide. Melatonin supplements, you can get these at most pharmacies as well as stores like Walmart, Target, online retailers. You should take 0.3 to 1 milligram of melatonin about 30 to 60 minutes before you plan to actually fall asleep. So it gets in there and gets some time to get into your bloodstream. Light therapy, getting outside is the easiest thing to do. Plan a vacation to a sunny place. We'll discuss more about light therapy in a few minutes, but you can buy your own light box or get outside and do something outside. It doesn't mean a lot of light, it just means about half an hour every day of decent light so that you can make the serotonin required for that balance between the melatonin and serotonin. Now, you may need some assistance, so you may need to have counseling, monitoring, psychotherapy. Now, if this is available to you, it can be quite helpful. Don't be resistant to this. And especially if you're not the kind of person who can keep that little health diary. If you find it difficult to sort through, well, what's a symptom? What's not a symptom? What's normal and what could be a sign or symptom? Then having someone to bounce these ideas off in sessions where you're counseled or monitored by a healthcare provider, this can be really helpful. And they can often then issue medications such as antidepressants or mood stabilizers, or even a hormone replacement therapy if it's the perimenopause issue that's going on. So if you're able to, and it's easy for you to go in and see somebody, then it's just an extra tool that you can use. Acupuncture is another treatment shown to help. However, I understand that it's not covered by all healthcare plans, so you may have to just go out, go to a shop, explain your situation, and let them do their things with the needles, and then you pay for it yourself. So it depends on how you want to approach this, but get help if you need it. So let's talk a little bit about vitamin D supplements. As I said, you can only get it through sun exposure, diet, or supplements. Now, this is the sunshine vitamin, and it's required for us to absorb calcium and phosphorus. You know, your mom always told you, you want to build your bones up and be stronger, get your vitamin D, get your calcium, drink your milk. But it also maintains other systems within the body. If you lack vitamin D, there's a cascade effect that happens in a number of areas inside your body. Now, recent studies are not conclusive, but there's evidence that shows the lack of vitamin D linked to a number of disease processes, including SAD signs and symptoms. So the good news is that we make our own vitamin D when our skin is exposed to sunlight. It's the easiest way for us to get it. It produces the fat-soluble vitamin D1, D2, and 3. When you go outside, just be mindful of your vitamin D production. If it's at all possible, if it's reasonable, go outside without sunscreen or sunglasses. You're not going to look directly at the sun. But if you're able to be outside for about 30 minutes without sunscreen and expose as much of your body as you are able to, then it allows your body to produce the amount of vitamin D that it needs. If you don't get enough direct sun exposure, then your diet's the next best thing. And on this slide, there's a number of ingredients. Keep in mind that it's a basic estimate of the international units. So after each food, there's an international unit of how much is in that food. So you can see that some foods are better than others to carry more vitamin D. So you just want to make sure that you check labels, because vitamin D is also something that's added to a number of things these days, such as milk, orange juice, margarine, etc. So you may get it in something else, cereal, whatever you're eating. You just want to check and make sure that it's there. And if your diet doesn't provide your vitamin D, then you can take supplements. And keep in mind, vitamin D3 comes from animal sources. It's more effective to raise the vitamin D in our bodies, whereas vitamin D2 comes from plant sources. So that one's the better choice if you're vegan or vegetarian and you just want to stay away from any kind of meat product whatsoever. But it's just not as effective as the D3. So 3 for meats, 2 for plants. And if you hear the term D1, then just understand that it's a generic term for either or. So nowadays you can get vitamin D supplements at local pharmacy, internet retailers, etc. Just keep in mind when you're taking it, 200 international units a day to survive, but 600 to 1,000 a day if you want to thrive. So if you're feeling depleted, if you think or suspect that you're low on your vitamin D, you want to replenish your levels. It's not a routine procedure for your healthcare provider to check your vitamin D levels, but they can. So you can ask them to do that. They'll only check it if you have concerns or if you're taking certain medications that interfere with vitamin D absorption. You can even buy a home test kit. I've seen them sold on Amazon. And if you find out that you are depleted in vitamin D, or you have a test, or you just suspect that you're depleted, then to replenish, you should take 2,000 international units a day for 6 weeks. Then return to daily recommendation, which is anywhere from 200 to 1,000. But keep in mind that it's stored until it's needed. So vitamin D, because it's fat soluble, will sit there. You can take it daily and it'll get stored up and you use it as it's needed. But you can also take larger units once a week to do the same thing. So, yes, it's possible that you can take too much, but this rarely happens. And recent studies, the most recent one I just read within the last month comes from the UK. 1 in 5 people in the UK are vitamin D deficient. So I wouldn't worry about that so much. And if you only do it like this, you replenish with the 2,000 international units per day, do that for 6 weeks, and then go back, you don't have to worry about having too much. So let's talk about your sleep-wake hygiene, which is in essence, these are all the routines that you perform throughout the day to maximize your sleep, re-energize your body, and ensure your best alertness and productivity. So just a side note with regards to shift workers, 10 to 32% of shift workers develop shift worker disorder. Now, this is a recognized disorder by sleep associations worldwide. It's not a DSM recognized disorder. It's not a mental health issue, but it is a disorder that all sleep associations are concerned with. Shift workers tend to forget about their sleep hygiene, sleep-wake hygiene, in their attempt to maintain a similar routine to non-shift workers' schedules. And dealing with banks or errands that they have to do, they're limited to time schedule of non-shift workers. This disruption creates a problem within the circadian rhythm. Signs and symptoms are similar to SAD, and complications include increasing the risk of cardiometabolic issues, cancer, gastrointestinal disease, mood disorders, etc. So SAD and shift worker disorder are similar, and their solutions are equally similar. So you're going to notice that with the next slide, we're going to talk about sleep and wake hygiene, but I'm going to be using the terms wake time and sleep time, not day and night. So all of this advice applies to whether your wake time and when your wake time and your sleep time happens. So it can be applicable to shift workers as well. So maximizing your sleep time. Shut things down at regular times. So taking away all the stimulants, including smoking, caffeine, snacking, especially sugary foods, game playing, watching TV. You want to start shutting that down at a regular time before your sleep time. If you're taking melatonin, you're going to take it 30 minutes before your sleep time. Darken your sleeping room. Again, so that your melatonin will kick in and your serotonin turns off. Pull the curtains and the shades. Turn off screens, computers, iPads, phones. Even your alerts and notifications, they may be silent, but sometimes they'll do that brighten the screen momentarily, and that should be eliminated because even that little bit of blue light stimulates serotonin even more than white light when it hits the retina. So, even if you're turning over, you're half asleep, and that comes up, it's going to hit your retina and it's going to start affecting you. So try putting the devices in another room or flipping them over so the screen is hidden. Our bodies need both bright light during our wake time, but absence of bright light and blue light, especially at sleep time, to properly regulate these cycles. Use tools available to you. Interesting that I've gotten lots of other tips that people do throughout their day-night cycles. And it's just interesting when you talk to other people and find out what they've been using. But there's free apps for smartphones and tablets that adjust the light emitted from screens to a red light. So if you have to use your screens for whatever reason before bed, or if you just want to, then switch the screen over to night mode. Or use blue light blocking lenses. They have actually glasses that you can wear that block these out, or covers to put over top of your computer screen, or smart LED light bulbs that can be programmed to adjust intensity and wavelength based on the time of day. So they're called dawn or dusk simulators. They may be called different names, but that's basically what they do. Aromatherapy, cool mist diffusers. This one's pictured here on the right-hand side. It can be used on a timer and with or without aroma. So it also helps your nasal passages to keep them clearer with the cool moist. There's also sprays for pillows, roll-on aroma for below the nose or pulse points on the skin. And a lot of hotels give these out as little pillow gifts to clients, but you can also just buy them yourself. Yoga or deep breathing exercises decrease stress. Let the stressors of your wake time be released and your physical body time to relax. Be kind to your roommates. If you have a partner, their sleep or lack of it can affect your sleep. So you may have to negotiate with this person to control behaviors such as snoring or blanket pulling, whatever. Try a cool environment. This can help sleep. Usually you have a nice warm cover over top, but it's common to put babies outside in a carriage, even in the wintertime, all bundled up. The cool air slows the metabolism, so sleep is better. And I'm not saying open all your windows and freeze to death in the middle of winter, but just cool the air around you down where you're all cozy in a big duvet. Decrease disturbances or eliminate them. Try a sleeping mask or the earplugs. Hang a do not disturb sign on the door. If a neighbor's dog is barking, you may find that you have to speak to them, but you have to try your best to decrease your disturbances that are around you. Take prescription medications as needed or directed. I kind of leave this one at the end because I would try other things before heading to the prescription medications. You can also get over-the-counter herbal medications. So there's many things that are put in capsules nowadays. One of the things that I've noticed is berry extract, and a lot of people swear by this. I have a friend who takes a concentrated berry juice, and it's just cherry that she takes, but there are other different berry juices, and she takes a tablespoon at night, and that seems to work for her. Also, I've just heard of somebody taking CBD oil, which is a derivative of the hemp plant, and just 1 tablespoon at night, and it helps to calm and de-stress you. It doesn't have any THC in it, so that's not the thing that's working. But the actual oil itself is actually very beneficial to the body. So whatever works for you, try some different things. That's going to maximize your sleep time. Wake time. Let the sunshine in. Open those curtains. Use the tools available to you. Same thing as before with your sleep time. Use a dawn simulator or LED smart lights. Or if you have a light box, this is when you want to use it in the morning. You want to get the light going in. Don't hit the snooze button. You don't have to jump right out of bed and be happy, but just get out of bed, even just to open your curtains. This allows your body to switch off the melatonin and start producing the serotonin. So be active. Try to perform more activity in the morning, a morning run or even a few warm-up exercises to get you going. Whatever you do, don't leave your activity too late in your wake time because then it's going to interfere with your sleep time. Diet. Eat or have a drink, something nutritious very soon after you wake up. That kickstarts the metabolism. Include healthy choices of food rich in vitamin D or tryptophan in foods such as egg whites, fish, meats, nuts, seeds, bananas, orange juice, milk, even if you have a glass of juice or a glass of milk first thing in the morning. Enjoy your coffee or tea. So it provides a small kick to your metabolism. It's not harmful when you're taking it in normal doses. Try to get outside at least 30 minutes. 30 minutes a day is better lux for you. We'll talk about lux in the next slide. Take prescription medications as needed. Again, it's the last on the list because I would suggest trying everything else first. And there's also some herbal medications out there. So you can go to a natural health food store and pick up some things, and maybe it'll work for you as well. But all these other things also help. So this cartoon caption reads, "This is for my depression. Go get your own." And he's got a light over top of him. Light therapy is also referred to as heliotherapy, phototherapy, bright light, light box therapy, whatever. It affects brain chemicals linked to mood and sleep, like we've already discussed, the melatonin and serotonin. So it benefits those suffering from SAD, but also with regards to other disorders such as depression and dementia, jet lag, or sleeping disorders. So the thing here is, it's kind of funny that he's saying this, but You can share your light with others. It's very beneficial. Setting up a light box in a central area, whether in your home or your workplace, it can only help your colleagues or other family members as well as yourself. Light therapy. When you buy a light therapy box or you're prescribed one and you get one, you can get one on your own from any internet retailer or a number of different stores. You don't have to have a prescription for it, but they can be a little pricey. So compare, and we're just going to go through some of the highlights, what you need, because you need to look for the quality. That's the most important thing. You're going to look for LED lights because that means the unit's going to last longer. It's going to work more efficiently as well. And you want to find one that has 2,500 to 10,000 lux. 10,000 lux being the ideal maximum possible requirement. Lux is just the amount of lumen level. So it's the amount of light that's coming out. So just keep that in mind and look for that particular amount when you're looking for your light box. The norm is white light. If you can get one with a blue light, that's great because it's becoming more popular. It's as effective or possibly better. In fact, studies have found that cells in the retina are particularly sensitive to blue light, like we talked about our screens going on in the middle of the night, and those are blue lights. Researchers are investigating whether if you have a blue light, you might be able to get the same benefits with less time than the white light. So great, if you can find a light box that has both blue and white light, then you can shorten your time that you're exposed and just use the blue light. So 30 minutes a day of 10,000 lux white light is the normal recommendation. So you can easily start with that on a daily basis if you're feeling that you might have an issue going on. Remember, it's best if you can find this on the label when you buy a light box, but there's usually somewhere where it says UV light is filtered. So in light therapy, UV light is filtered out so it can't cause damage to eyes and normal skin. So during light therapy, you want to sit near your device. So about 16 to 24 inches or 41 to 61 centimeters from your face. So pretty close. And that way it's effective enough to enter your eyes indirectly. You don't look directly at it. You sit near it. So your eyes are open but not looking directly at the box. And it's time and consistency that are important here. So every day, certain time, 20 minutes, 30 minutes, whatever time you pick. You can coordinate it with something you're doing, like this particular lady who's talking on the phone and eating her breakfast. You could put it close to your computer if you get up and use your computer first thing in the morning, because light exposure therapy is best done first thing in the morning, so it stimulates the serotonin, shuts down the melatonin right away. So there's lots of options out there. There's desk lamps, there's light visors, there's dawn simulators. The dawn simulators tend to not be the same as a light box, but you might be able to hook up enough lights. I've seen people do it on YouTube videos where they hook up enough of their own lights that they create the equivalent of 10,000 lux and have their own light therapy box. There's a number of risks. So if you're trying this on your own, or if you've been prescribed this, you want to be aware that some of the risks could include eye strain, headache, nausea, irritability, or agitation, especially if you've been diagnosed already with bipolar, but definitely if you start to have sort of mania or euphoric, hyperactive symptoms, agitation, then you may want to stop this. And the nice thing about light therapy is that if you have any uncomfortable reactions, you can just stop it, and all of these things go away immediately. Now, you shouldn't be using light therapy if you're sensitive, you have skin that's sensitive to light, such as lupus erythematosus, if you're taking antibiotics, anti-inflammatories like ibuprofen, Advil, naproxen, or St. John's wort. If you have eye conditions that are vulnerable to light, if you're being treated for glaucoma, or even if you've had a regular eye exam where they put those drops in, you don't want to be using your light therapy at that point in time. And anyone who has been diagnosed with bipolar disorder should not proceed with light therapy without medical supervision. So calculating how much light we need is confusing and relatively impossible. I can't give you an accurate formula for your daily lux needs, but I can give you a few hints. For example, this is an interesting slide. It's a visual aid to help you understand the lux we're getting in different situations. So notice how large the amount is on a sunny day, but even on an overcast day, it has a lot. So even if your house, you're sitting beside your window and it's an overcast day, you're still getting some sun in through that window. It's indirect sunlight, but it also provides lux as well. But most of the time, our homes and offices that we think are bright are not really providing as much lux as we should have. When you start looking at the actual facts, taking inventory of your surroundings, and assess your daily exposure levels, are you really getting as much as you need? So here's another tool. Nowadays, you can easily download an app onto your phone to measure the lux of your surroundings. You can get a basic lux meter app for free, although usually there's going to be advertisements with it. If you pay a small fee, you can get it without the advertisements, but I find I can ignore them. But this will give you the information to help you plan how to get the most lux out of your day. All light exposure is not created equal. So in simple terms, this is the little formula. A dose of light equals the brightness of the light plus the proximity to the eye multiplied by the duration of exposure. Any of these figures starts to rise, the higher the dose of light you get. So I found it interesting taking my lux meter around in places where I sit. And if I sit in one direction, either towards the window or beside the window, just by changing my chair, I can change my lux by as much as 100 to 300 lux. So it's worth it to get a meter and find out whether you are getting enough lux. So as we discussed, antidepressants are an option, and the antidepressant at the top of this slide is the best one. So try that one first. But if you find it's not enough, then please don't hesitate to go find somebody, go to your healthcare provider and discuss getting something else like the one at the bottom. Know when you need to get help. So in this little cartoon, Tigger says, "Tigers don't bounce with seasonal affective disorder," and he's asking if his buddy has any extra meds. So yeah, not probably good just to talk to your friends. You should go to your healthcare provider, but talking to somebody is helpful. At least they might just say, hey, why don't you go to a healthcare provider and see what you can get. But on your own, there's over-the-counter herbal medications, and if you've tried what you can on your own and it's just not working, then it's time to go to a healthcare provider. And there's a number of drugs that they can give you in order to help: antidepressants, mood stabilizers, and things that can help you. Can we prevent it? I'm not going to review absolutely everything that we've talked about, but yes, you can't completely eliminate it. So if this is something that happens to you and it's directly related to the seasons, unless you make a long-term change, and long-term changes are not something everyone can do. They're not always within the ability of a person to do it. But if you can, changing your job so that you're not working shift work, changing your place of residence, moving to a different climate where the sun is more regulated for you. Of course, that's the long-term effect, and it will have the most beneficial effects, but it's not always feasible. So since we can't eliminate the disorder and you're affected by it, then you can mitigate the severity of the symptoms and increase your ability to cope with it. And in order to do that, you have to look at some of the things that we talked about already, your lifestyle and exercise, your sleep-wake hygiene. Use some of the tips that we talked about with regards to getting better sleep time and better wake time routines going. Vitamin D supplements, melatonin supplements, light therapy, getting outside, finding out how much lux you really are getting so you can make sort of a regulation on how many lux you need and how to get them. Getting your own light box, go on a winter vacation, decrease the stress that's in your life so that you can get on a better regulatory system with regards to your melatonin and serotonin. And ultimately, if you need help, see your healthcare provider. Make an appointment to eliminate other causes of the symptoms at the very least. So you're doing everything that you can to make sure it's not something else and then dealing with the issue yourself. And if you find out it's no other illness, then you can say to your healthcare provider, could it be seasonal affective disorder, and could I just try doing things on my own? But if I need help, I'll come back to you. You can make a plan like that with your healthcare provider. They love hearing that kind of stuff. This is just a list of resources that I've used in order to compile this information. And some of them can be interesting, especially the videos. But if you have any other questions or follow-up concerns, please don't hesitate to contact me. This is my contact information, or contact your nearest healthcare provider. Hopefully you're not sad today. Hopefully you're not being affected by seasonal affective disorder. And this is something that you can prepare for in your future. And thank you so much for joining me in this presentation today. Goodbye, everyone.